Hi, I'm Georgie Kasani, and I help nurses and nursing students explore career opportunities at BJC Healthcare. We are live from the National Black Nurses Association's annual conference, which is in St. Louis this year. BJC Healthcare is a conference sponsor, and we are hosting a meet and greet for the attendees so they can learn more about BJC and how we make medicine better for our patients in the communities here in St. Louis and across the region. We have several members here today from our employee resource group for diverse nurses to share their experiences and talk about how they advance their career at BJC. I am proud to announce and introduce BJC's Workforce Diversity Manager, Terry Hart, to speak about diversity and inclusion in our workforce.
Hey.
Welcome, Terry.
Thank you.
Can you talk a little bit about the work we're doing inside BJC and the community to support diversity and inclusion across our work?
Georgie, happy to. Inside BJC, we are really, it's all about our patients and our families. We have diverse patients and families that come from all walks of life, all backgrounds, and we just want to make sure that we have a workforce that is there and ready to serve our patients and our families.
Sure.
Outside of BJC, we are using some of our BJC connection groups, which we've formed to serve within BJC and serve our patients and families, and specifically our diverse nurse group who's here tonight for the convention and the conference. They actually go out into the community and work on the health fan and making sure we're taking medicine out to our community. So that is one of the ways that our community, we serve our community.
Sure. Why is a diverse workforce important for BJC?
As I mentioned, we have patients that come from all walks of life, and I think that our workforce, reflective of those patients and those families, provide better medicine.
100%. And why is it important for BJC to sponsor the NBNA conference this year?
We're excited about sponsoring the conference. You know, the National Black Nurses Association, I don't know if this is their first time in St. Louis, but this is the first time in many years, if not. And we wanted to make sure that they knew who BJC Healthcare was, being the largest employer. And we wanted to make sure that we welcome to St. Louis. That's what we do, right? We welcome folks to St. Louis, and we're hosting a meet and greet. So come and join us, have some food and drink, and we are just hosting our people that have come in town.
Thank you, Terry. Sounds like we have some exciting things ahead.
Thank you.
So again, we are live from the National Black Nurses Association Annual Conference. I'd now like to welcome a nursing leader, Kelly Allen, to share her experience on how she makes medicine better at BJC. Welcome, Kelly.
Welcome. Thank you.
Can you tell us about your role at BJC and where do you work?
I'm a clinical nurse manager on an acute care medicine floor at Barnes downtown.
Can you tell us a little bit about the importance of developing our nurses and providing opportunities to continuously learn and grow?
Our mission as the staff nurses essentially is to continue education to help with evidence-based research, to know what's on the forefront coming for innovation type things, and just to know how to handle ourselves professionally in the workforce. So what is really good about that is that we want to make sure that our nurses are ahead with all the current education to put them on a platform for continued advancement in the workforce.
How has your leadership role at BJC helped you grow in your career?
I can tell you what it does is it puts me in a position where I can use my platform to reach my mission, which is advocating for my patients and my team and building great teams. So when I can do that, I can either promote them within my organization or unit or within BJH.
Fantastic. This year, the NBNA conference theme is the art and science of nursing. What does that theme, the art and science of nursing, mean to you?
The arts and science of nursing, what I see is that a nurse can be trained by any facility or college, I should say, for education. But the arts for me is their background for their diversity, their culture, their education. And I think that's the art, putting it all together and making it unique for that patient experience.
Thank you. We appreciate your expertise, Kelly. Enjoy the meet and greet.
Thank you.
As a reminder, we to tell our viewers we are live from the National Black Nurses Association annual conference hosted in St. Louis this year. BJC is a conference sponsor, and we are hosting a meet and greet for attendees so they can learn how we are making medicine better for our patients and communities. You can visit bjc.jobs to learn more about nursing careers at BJC. We also have career opportunities in different clinical and non-clinical departments. So again, you can learn more at bjc.jobs. I'm very excited to announce several members of our employee resource group for the diverse nurses here to share their experiences and talk about how they've advanced their careers at BJH. I'd like to welcome Crystal Nelson and Kelsiera Matthews. It's my pleasure to bring y'all here. Can you tell us what you do at BJC and where you work?
So I work at St. Louis Children's Hospital. I work in the community. It's called Community Health Advocacy and Outreach. So we take health services to schools and daycares and preschools and church groups.
And I work inside the hospital. I'm in float pool, which means that I go to the ICUs, the EU, and the general med-floor populations.
Both important works. Can you tell us a little bit about the BJC Diverse Nurses Connection Employee Resource Group, what you do and what your mission is?
Okay, I'll tell you a little bit about it. It's really sort of a smaller segment of the BJC family for nurses of color and then their allies. But it's a great support for nurses of color to come and kind of a fellowship, that kind of family atmosphere. You're able to use a nurses from their experiences and use them as sounding boards, but then also we are sort of mentors to aspiring nurses. So if there are staff within the BJC family that they want to go to nursing school, they have a group already in place to kind of, what is the experience like, if they have questions, and as they're kind of toughing it through school and through that whole wonderful nursing experience, they have some nurses that have already gone through it that they can talk to and get support from.
Fantastic.
Yeah, and we also just reach out to other diverse nurses and other diverse groups just to let them know that we're here, and we work with our allies to help them to understand how to care for a diverse population, because within the BJC family we take care of a lot of diverse patients. So it's very important to learn how to take care of patients that might not necessarily look or speak like you, so that you don't offend them, but you can be yourself without offending them.
Thank you both. Why do you think it's important that we do have a diverse nurses connection group at BJC?
It's very important, especially with the different things that happen right here in St. Louis with the Mike Brown situation and things like that, so that to bring awareness to that and not shy away from that, and to bring that home to say, hey, we can take a stand without offending others, and to help others to know that things like this do happen, but what do you do when that happens? And so that's very important to me.
And to build on what Sierra said with the Mike Brown situation, and then I know we've had other situations. A place where they can go to and feel like they can speak freely without worry about offending anybody, and just feel supported and know that BJC welcomes this. It's really important in the mission to provide that support for nurses of color. So, yeah.
Thank you all.
Great.
BJC will have a pretty big presence at the conference this year. Can you talk about what that means to you in your hometown?
Okay. So, yeah, I grew up in St. Louis from here. Moved away for a while, but I'm back. And so I think it's great. I want BJC to be known as a place if there are African-American nurses around the country. That was my experience as I moved from state to state. Where do I want to work? Where is going to be welcoming? Where is going to be a good place for me and going to be invested in my nursing career? I want them to think of BJC as that place.
Right. It also lets them know that we're just saying that we're a diverse hospital. They're here, right here. And this is actually the first hospital that I work for that I've seen that they've actually put the work forward to let us know that, hey, you are important to us, and we're going to show you just how important you are to us.
I can't thank you both enough, Crystal and Kelsiera, for sharing what you've learned here at BJC. Enjoy the rest of the meeting.
Thank you.
You're welcome.
Thanks. Bye.
I'd like to remind our viewers we are live from the National Black Nurses Association here in St. Louis, and it is with great pleasure that I introduce one of our own BJC nurse recruiters, Wanda Walker, to share some important information with you. Hi, Rhonda.
Hi, Joy.
Welcome.
How are you?
I'm doing well.
Thank you.
Can you talk a little bit about why it's important to have events like this from a recruiter's perspective?
Absolutely. So from a recruitment perspective, we're always working hard to try to make sure that we're hiring clinicians that reflect the population that we serve. And that's also the mission of BJC. So with the NBNA conference, this is actually my second year attending. Last year it was in Las Vegas. And even though I was able to talk to them about St. Louis and about our hospital, a lot of them were so excited that the conference was going to be here this year so they can actually learn more about the hospital, learn about St. Louis, learn about our opportunities that we have for nurses. And as recruiters, we're always trying to look for a way to just kind of cast a wider net when it comes to recruitment efforts. So NBNA conferences and these have been very beneficial for us from a recruitment.
I'm glad to hear that for you and the work that you do. I know that you do attend some Diverse Nurses Connection group meetings.
Mm-hmm.
What have you learned from that experience?
So I really enjoy the Diverse Nurse Connect group because we're able to actually get referrals from some of our clinicians that are there. So the nurses there, I always think of it that good nurses and good clinicians know other good nurses and other good clinicians. So a lot of times we're able to take positions there and share them with the team, and they actually have people who are really interested that they can refer to us. So even though they do go online and apply to the position, we're able to still reach out to that particular person and just kind of talk to them about the position, and it's really been helpful for me from a referral perspective.
That white glove experience.
Yeah, absolutely,
Yes.
absolutely.
So how can someone learn more about nursing career opportunities here at BJC?
Yes, so all you have to do is just visit our careers website at www.bjc.org, and we have actually all of our positions there.
Fantastic.
Yeah.
Well, if you enjoy the meet and greet, thank you for
I am
coming
very
by.
excited. Well, thank you
Sounds
so
good.
much,
Thank you,
Georgie.
Rhonda.
Bye-bye.
See you later. Again, as Rhonda Walker said, you can learn more about nursing opportunities and other non-clinical jobs by visiting bjc.jobs. Thank you for watching.